Remember that old saying, you can't fool Mother Nature? Well, that used to be true, but with today's technology, you can sure give her a run for her money.
Slowing down the hands of time has never been easier. We're joined again today by Dr. Michael Jasin from Jasin Facial Rejuvenation Institute to tell us just how accessible these simple procedures can be. Good morning, sir.
Welcome back.
Good morning. How are you?
Very well. We love it when you're here because we love all this kind of make yourself pretty stuff. And the last time that you were here, you told us about the Fulfill Lip Implant. And it's kind of all the rage. It's been featured in magazines. So tell us a little bit more about that.
Okay, well, this is really a very innovative device. And just a little history. I have historically used a lot of implants in lips over the years. They were typically made of a substance called EPTFE to keep it brief. But it's a solid material like Gore-Tex. Gore-Tex, probably you're familiar with.
Like a jacket?
Yes, same type of material.
Yeah, that's like skiing, right?
So your ski jackets can make your lips look bigger too.
Wow.
Okay,
so your lips are warm and waterproof.
Absolutely. So we used to use that type of material. Then about 4 years ago, a new filler came out called Radiesse, which to me was a little more versatile in how much correction we could get. It gave a more natural feel. And so we saw this type of result with Radiesse, and I converted from implants to Radiesse to get that more natural look and feel. Now this product has recently come out in the last 6 months in the United States, and we're getting this type of correction. And this is an inflatable implant. The inner shell is made of silicone and is filled with saline. The outer shell is the EPTFE we always used to use. What happens is that silicone-filled sac will float around within the outer shell. So when you touch it, it moves around and makes the lip feel much more natural. And it's tapered, so it follows the contour of the implant. And you can see again here, we're filling out not only volume in the lips, but smoothing out the lips and making them look much more youthful. And luscious lips are kind of the rage right now, and they have been for several years.
Well, no, as opposed to an injectable, how long does the implant last?
Well, that's the beauty of it. Injectables may last for a period of months, Radiesse 1 year, possibly more. This is permanent. So for someone who knows they want fuller lips but would like the permanence of another product, this is a perfect solution.
Oh, that's fabulous. So you're eliminating the constant maintenance that goes along with it.
Absolutely, and it's a 20-minute procedure done under local anesthesia in the office. 1 stitch in the upper lip, 1 stitch in the lower lip, a minimal downtime, a day or two, put some ice on, and you're good to go.
Now, I love the before and after pictures, as do our viewers, but I am going to ask you this. I need you, just for the sake of feeling how real these are, to bring someone in for me to kiss the next time you're here.
Well, I happen to have some implants. If you...
We make great television.
Yes, we do. Well, there are obviously a lot of cosmetic procedures to choose from, and you are on the forefront. You just got back from speaking in Austria, and some of these now that you've perfected are now becoming industry standard. Like was it the Simplicity?
Right.
What is it that you are coming? You're on the leading edge of this, and now other people are adopting your program. So obviously you're the go-to guy.
Well, we've developed a collection of procedures we call simplistic or simplicity surgery. And the idea is to minimize downtime for the patient, maximize their results, and maintain a natural appearance and not look surgical. And what we try to do is apply a collection of techniques that I've gathered over the years. And I've been doing this for 25 years in Tampa now, facial plastic surgery, and I've limited my practice to facial plastic or cosmetic surgery over the last 10 years completely. And what we've done is try to cherry pick these techniques to get procedures that will allow the patients to get these kind of benefits in the neck. This is our Simplicity neck lift, a 1-hour procedure with some liposuction and done under local anesthesia again. So you can see some dramatic results similar to what we saw with the facelift back in the old days, but now we're doing small incisions. This is a 1-inch incision underneath the chin.
And you've talked about how your goal is to be as non-invasive as possible.
Right, and here we're using laser technology to do a laser-assisted blepharoplasty. We're one of the few centers in the area to use a laser for blepharoplasty or eyelid surgery. Helps to minimize bleeding and makes the procedure go more quickly.
And we've got one more. And I also like, as you walk us through this, how you combine the different procedures for the best results.
Absolutely. This is an example of laser skin resurfacing, and you can see some dramatic results there. But we also offer various levels of laser resurfacing to customize it to the patient. And what we like to do is have the procedures that we offer conform to the patient's lifestyle versus the patient's lifestyle having to conform to what we offer. So that's why we offer such a wide array of procedures, both surgical and non-surgical.
Now, it comes down to not just all of the procedures that you offer, though. You offer the whole experience. And what should people look for when they're looking to choose where they're going to go? Obviously, they're going to come to you.
Well, I hope so. Well, you can learn a lot as soon as you walk in the door. If the waiting room's packed with a lot of people, and you can tell it's a herd 'em in, a herd 'em out type of operation, you're not going to get very personalized attention. So you want to kind of get an area where you feel comfortable. They're going to listen to you and take the time to know what you need. Look at the decorations. Is the office clean and neat and up to date? What's the staff's demeanor? Are they friendly and accommodating? Are they knowledgeable? That sort of thing. Will you be able to see the doctor the day of the consultation?
That's very important with anything, but especially with this. I mean, you go into some operations, some medical practices, and you don't ever see the doctor. You see the PA or the nurse practitioner. And I think in your case, it would be really important to get a feel for what the doctor's all about.
Oh, yeah.
Well, the staff's very helpful in sorting this out, but it really comes down to making a decision jointly with the patient and the physician about what's the best treatment plan for them, and whether we're going to combine the non-surgical methods with the surgical, or whether we're going to do strictly surgery. And if we're going to do surgery, what types of surgical procedures can we offer? So it makes a big difference in especially when you're offering choices. If you've only got, there's a saying that goes, if all you've got's a hammer, everything looks like a nail. So you try to fit everybody into the same category, but everybody's different. And if we sit down and take the time to understand what everybody's individual goals are, we can outline a much better treatment plan for them.
That's fantastic. So when people come in and they know what they want to look like, but they don't know how to get there, then you're mapping it out for them. They don't leave feeling like they don't know what's going to happen.
No, we like to give them options and choices, and I think the other thing to look for is whether you're going to have access to the physician's credentials, whether they're qualified to do what they do, what's their success rate, what's the patient satisfaction rate. We have my total CV online at our website at www.jasinfacial.com for those who want ultimate detail. But we also have summaries of my biography for everybody that comes in the office.
Let's also take a few more looks at these simplicity pictures of some of the befores and afters, which I absolutely... the last one, you took 20 years off the lady, and it looked completely natural.
Well, this is a patient who's only 2 weeks post-op, and in a week you still couldn't tell she had surgery. She had the simplicity lift for her lower face, forehead lift for the upper face, and the lip implants, the Fulfill implant.
Wow, that's great. Total
this
package.
is a patient who had a simplicity lift and then came back and did some injectable fillers to recontour her cheeks and jawline a little further. And you can see how the combination produces a very natural yet stunning result.
Absolutely stunning.
And this patient also is 2 weeks post-op, simplicity lift, forehead lift, and had some injectables to recontour the cheeks as well.
That is just amazing, the result. I love these. This is fun.
You can actually
fun for
see.
you.
Well, it is. And having the diversity that we offer makes it nice because I'm not doing the same procedure every day. And we're doing different combinations for different people and seeing high quality results in different ways.
Excellent. Dr. Jasin, always a pleasure. Thank you so much. We look forward to seeing you again.